Hi, this is Dr. Nick from the ECG Academy, and we're going to go on with sinus node dysfunction, talking about sinus pauses and sinus arrest. Well, we talked about sinus bradycardia already, and we talked about chronotropic incompetence. Now we're going on to the next section here. Now, here's the strip that I showed you before with that periods of severe sinus bradycardia. Well, what would you call severe, by the way? Sinus bradycardia is a rate below 60, but generally, if I see rates below 50, I start to call it severe sinus bradycardia. Rates of 45, 48, that's pretty low. And when you're coming up with an electrocardiographic diagnosis, I would say that's kind of the cutoff, although I think it's a little bit more arbitrary than some of the other definitions that we have. Anyway, here's the strip that was showing very slow heart rates. Let's count this off. That's 300, 150, 100, 75, 60, 50. It's quite a bit lower than 50. It's below 40, probably like 38 beats per minute or so. But you notice that these two beats are fairly even, just like about the same rate as this. But if this is a continuous strip, then you suddenly have this long part where the two P waves are very far apart. And I just want to point this out because this is often referred to as a sinus pause. What is a sinus pause? It refers to a situation where the sinus node sort of takes a nap and you don't get a P wave for quite a period of time, usually more than a second and a half or so. Some people will talk about 1.2 seconds, a sinus pause, and you'll see that written on certain rhythm strips that you'll see on a CCU. Well, a sinus pause basically just means that there's a sudden deceleration in the heart rate, that the sinus rate suddenly drops. Now, a pause can be anywhere up to 3 seconds. And if you count this up, it's in milliseconds, it's 2, 4, 6, 8. That's 1 second, 2, 4, 6, 8. That's 2 seconds, 2, 4, and another half. So it's about 2.5. So people will label this as a 2.5 second sinus pause, and that's fine. These are almost 3 seconds. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. And look at that. So it's not quite 3 seconds. It's 2.9 seconds. That's a 2.9 second pause right there. Okay, but pauses basically we see up to 3 seconds. If it's over 3 seconds, then that's what we refer to as sinus arrest. Now, it's really semantics. It's really just a different definition, but I'll show you what a sinus arrest looks like. In this rhythm strip, it's a different patient. We have a pretty slow sinus bradycardia here. If we count it up, 300, 150, 100, 75, 60, 50. It's above 40. It's somewhere maybe 42 beats per minute or thereabouts. And it's fairly regular, very slow. So you'd call this a marked sinus bradycardia. And then it starts to decelerate even further. You've got a long interval here. It's 1, 2, 3, 4. 1 second, 1, 2, 3, 4. Just about 2 seconds. So that equals 30 beats per minute. Right? Remember that if you take the number of seconds, divide into 60, you get the rate. So 2 second interval is 30 beats per minute. And then look at this long pause. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. Holy schmoly. It's more than 4 seconds. So we would call this sinus arrest. Some people won't use that terminology. They'll be very vague about it. They'll talk about a 4.1 second pause. Either one would be correct in the normal vernacular, but strictly speaking, it could be referred to as sinus arrest. But I want you to notice something, that following this pause, the beat that interrupts the pause does not have a P wave in front of it. Well, what does that mean? Did the P wave disappear? Why did the P wave disappear? If there's no P wave in front of it, where did this beat come from? Okay, well, think of it this way. You have your sinus mechanism, which is, of course, arising from the top of the right atrium. But all the cells in the heart are capable of depolarizing spontaneously, aren't they? Your AV node here in the central part of the heart. It's connected to the His bundle Purkinje fibers. And the AV nodal fibers, those cells are similar to sinus nodal cells in that they're able to spontaneously come to threshold, and they're spontaneously able to fire. And there is a pacemaker current that's going on in AV nodal cells, except the rate is much slower. All right, in a normal sinus nodal cell, the heart rate at rest, as I mentioned, would be somewhere on the order of 60 to 80, but AV nodal cells depolarize at a much slower rate. Generally, AV nodal cells depolarize somewhere in the range of 40, maybe 45 beats per minute. If you cut out the AV node and let those cells fire on their own, under normal circumstances, this is the kind of rates that you would get if the AV nodal cell, or the junction between the atrium and the ventricle, would start to fire at. So what happens if the sinus node doesn't fire? What happens if there's no P wave? What happens if you remove the stimulation from the atrium, from the AV node? Well, the AV node basically will say, hey, what's going on? I haven't seen a beat in such a long time. And so the absence of sinus P waves will result in the AV node firing. That kind of a situation will give rise to something called an escape beat or an escape rhythm. An escape rhythm refers to a lower pacemaker center, such as the AV node or the AV junction, same thing, firing at a much slower rate because of the loss of stimulation from above. And we will talk about this in more detail in the physiology chapter, which you'll find in the advanced course. But basically what this amounts to is a junctional escape beat. Okay? It has the same shape and size as the normal sinus beat. So basically this beat took the same normal conduction pathways. It went down the His bundle, and it resulted in a QRS complex that looks exactly the same as the normally conducted QRS complex here. But there's no P in front of it. So it tells you that it started somewhere in the AV conduction system, somewhere in the AV node. This beat arose, and in fact, if you look down here, you'll see that there's a series of beats with no P waves in front of them at a rate somewhere that's in the range of about 35 to 40 beats per minute. And that's where you can basically diagnose a junctional escape rhythm. Okay, a junctional escape rhythm happens when someone develops a problem with the conduction system. This can happen in severe sinus bradycardia, or it can happen in patients who develop complete AV block, which we'll talk about in the next section. So basically, these are beats that came from the AV node, firing at a slow rate. So these beats are about 2 seconds apart. This is a rate of about 30 beats per minute, which is a little bit slow for a junctional escape, but not unusual when you have underlying conduction system disease. You know, here this patient was going at a very slow sinus rate, and just basically the whole entire conduction system is likely to be diseased here. So even though the normal AV nodal rate may be 40 to 45, it's not unusual to see rates of 30 or so. So this is a junctional escape, and what you have here is a patient with severe sinus node dysfunction, a sinus arrest, and a junctional escape rhythm at a rate of 30 beats per minute. You got that? Okay, kind of a fun strip there. Just recognize the terminology that we use. Severe sinus bradycardia, sinus arrest would be greater than 3 seconds. Now here's another example of a sinus pause. But this is a very unique situation, and it's written down here. It's called a post-tachycardia pause. I want you to notice that there's this pause in the rhythm. If you look along this ECG, look at the forest, you'll find that the heart rate on the left-hand side is a bit faster, a wee bit faster. It's actually looking about 150 beats per minute at parts. These are 2 boxes apart. And then it kind of slows down on this side. And what you have here is a pause with a very flat segment. Now, you might even think that, maybe this is one of those make or break artifacts. Maybe the patient came off the electrodes, one of the wires fell off. But it turns out that this is a particular rhythm disturbance known as atrial fibrillation, and we'll get into this in a later section. But atrial fibrillation occurs when the top chamber of the heart is got an electrical disturbance that results in very rapid, irregular, chaotic activity all going around in different directions. And so instead of seeing discrete P waves, what you see is almost a continuous, irregular, chaotic electrical signal that's going on. And you can see some of that here and here. You can see some of it, some of these rapid, irregular signals are here. And so what this patient has is atrial fibrillation, and the AV node is conducting these signals down pretty quickly. So you have this rapid heart rate somewhere in the range of about 150 beats per minute here. It's a little bit slower in this region, maybe 100, 120, but you've got this rapid arrhythmia, right? So this atrial fibrillation is going on, and then suddenly, right at this moment, it stops. The atrial fibrillation comes to a stop, and this rapid electrical chaotic craziness just kind of like goes away. And now what happens is the sinus node is left to pick up the pieces. The sinus node here has to now fire and start a normal sinus rhythm over again. And what you see here is a very nice sinus P wave. You can see it in all three leads, a nice sinus P wave with a normal PR interval and a normal QRS complex. But it took a while, didn't it? It took quite a while. If we count up this time interval, it's 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. It's about 2.2, maybe 2.3 seconds. So you have about 2.3 seconds of a sinus pause following termination of this atrial arrhythmia, this atrial fibrillation. So we refer to this as a post-tachycardia pause. Post meaning after. So post-tachycardia pause is, well, it's a sort of a normal physiology, except this is a rather long pause. I've certainly seen longer, but this suggests that the sinus node is a little lazy in coming to the rescue after this atrial fibrillation stops. So this is kind of an exaggerated pause. We usually shouldn't see more than maybe a second and a half or so after atrial fibrillation terminates. So this may be a reflection of a particular diagnosis known as tachycardia bradycardia syndrome. So tachybrady syndrome is a situation where you have sinus node problems and you also have atrial tachyarrhythmias like fibrillation and flutter. We'll talk about those in the subsequent chapter. But you can have very rapid arrhythmias in the top chamber, but the sinus node also has problems as well. So often the heart rate is either too fast or it's too slow. Well, of course, in this case, what follows are a series of atrial premature beats, which we'll talk about. Here's a sinus beat and then a premature beat again, and then you're back to a sinus beat. So you kind of got a lot of atrial ectopy or premature beats that are going on. This is all stuff that we'll cover in subsequent sections, but I wanted you to know exactly what this is so that when you see it again in the future, you'll begin to recognize it. Because after all, what I'm trying to do here is teach you to recognize abnormalities that you will see over and over again. So here, evidence of tachycardia bradycardia syndrome with post-tachycardia pause here of 2.3 seconds. You need to be able to recognize that if you want to make the right electrocardiographic diagnosis. Now, in the next video, we're going to talk about a very special type of pause due to a physiologic abnormality in the conduction of the sinus impulse to the atrium, and that's known as sinoatrial exit block. So I'll see you then. Until then, this is Dr. Nick with the ECG Academy. Thanks for watching.